Telehealth services have been made available to millions of people over the past year. The federal government provided the funding to reduce face-to-face consults during the pandemic. But it ends on June the 30th and medical experts are worried about what happens next. Here's Betty Chetcuti, a director at the Australian Association of Psychologists. Hi, Betty. So what's been the result of having increased access to telehealth for people who have mental health issues?
Yeah, so what it means is that clients across Australia are able to have that contact with their psychologist, which is just so vital during this time of the pandemic and all the consequences of that with, losing jobs and families all being at home together and increased stresses there. In short, what it's done is increased access and enabled an ongoing excellent service provision by psychologists.
Yeah, and has it encouraged people to make contact and ask for help for the first time?
Yeah, it has, because some people, live very far away from their psychologists, and, this is even within urban areas. In rural, they've had telehealth. People have got mobility issues, disabilities. We have people who, have got young children for the first time during the pandemic, and with the additional stresses of the pandemic, it's one more thing that they are struggling with just to get to the appointment, whereas this way we can just pick up the phone and speak to our clients. I've had clients who like to see me face-to-face, but then they might have emergencies at home or crises that they're dealing with. And this way we can maintain continuity because they can stay at home and pick up the phone. And once again, we're maintaining that excellent service provision and they're just able to have the access.
Was the transition, though, from face-to-face to telehealth quite challenging for some people?
I think in the beginning, for both the psychologist and the client, we weren't used to that. But there's been a surprisingly positive uptake, and it's continued all of these months. It hasn't just been a 6-week, process. We've had ample experience now to know that it's effective, and they cope really well with it. And even my clients who, after the pandemic and the restrictions have eased off and they seek a bit of face-to-face human contact, they're okay now to do telehealth, and they're coping really, really well, and the service level is being maintained, which is the most important part of the process.
So what are your expectations when telehealth services return to their previous funding levels at the end of June? What do you expect to happen?
Well, what we're really anticipating, really, so the government's put in this process for telehealth. So that's based on international evidence that telehealth works. That's why they've offered it as a service option. And what we would really like is for government to really reassure the Australian public and psychologists that just give some advance notice that, yes, look, this is going to go ahead. It's one of the Productivity Commission's main priorities that telehealth be be made permanent and that it be made available across Australia, regardless of where you live, whether you're in the city or in rural, remote Australia. So we're just expecting that it's going to continue, but what we really are wanting is just that level of reassurance when there's so much change, people are losing jobs and not sure what's going to be happening in their lives with, maybe there's another COVID outbreak. But we do want at least this level of reassurance that we can continue to have access via telehealth.
And more broadly, Betty, has COVID and the lockdowns increased awareness of mental health issues, while recognising, of course, that many people have struggled with the added pressures? Are more people aware of the signs of mental health problems?
Well, people are becoming aware. We're certainly talking more about it. People are accessing mental health social media kind of information services. So people are more aware of it, they're more comfortable to talk about it, and that only adds to the access to service provision, the ease of comfort. So they're more likely to be able to say to their psychologist, look, to their doctor, look, I'd really like to see a psychologist. I think that is just such a great conversation to be having because we are all suffering. This is not just an Australian phenomenon. It's happening all around the world. We're all suffering. And we just really want to work together with the government to provide the access just to be able to do our job and help people deal with their experiences. And some of those, might be, they've had a job loss or, as I mentioned before, they're a young mum or a young family struggling with children at home. But a lot of the people that registered psychologists work with, they have severe, complex, chronic mental health conditions. And And what this is going to help them to do is to be able to maintain the access. And we just really wanted to work with government to say, look, just let us know that this is going to be a permanent option so that we can continue the work. And it's in line, as I said, with the Productivity Commission, with international research. This is just based on what they do as part of their usual offering.
Betty Chetcuti, thank you.
Thank you, Roz.